Your Excellency, President of the Republic of Kenya and Commander-in-Chief of the Defense Forces, my colleague, Excellency Governors, Cabinet Secretary, Ministry of Health, Ms. Susanna Kumicha, Mr. Lee Den Morrison, representing the Global Fund, Dr. Gitahi, Regional Director, AMREF, representatives of national and county governments, development partners, private sector representatives, ladies and gentlemen. I would like to begin by thanking His Excellency the President for fostering a good relationship between the national and county governments. The collaboration between the two levels of government is critical in achieving Vision 2030 and by extension ensuring every Kenyan citizen has access to the highest attainable health standards. Since the onset of devolution, county governments have invested significant resources in strengthening health services and achieved good outcomes across all health system pillars. We have stepped up health facility infrastructure and equipment, increased focus on healthcare workforce, and increased budgets allocated at county level to health services. Today, we have a keen focus on primary healthcare and community health services. This launch, Your Excellencies, ladies and gentlemen, goes a long way in improving the capacity of our health system across all 47 counties. As such, the Council of Governors is glad to be part of this flagging off. The universal health coverage agenda is the hallmark of the Kenya Kwanza government's commitment to improve the well-being of Kenyans by ensuring that people have access to the health care they need without suffering financial hardship. Achievement of UHC is not just a health sector matter, but one that requires multi-sectoral action, especially in addressing the social determinants of health, like education, physical and social environment, and the wider set of forces affecting people's health and their access to health services. To attain UHC, both levels of government as well as other actors like the private sector must work together in strengthening health service delivery. Your Excellency, ladies and gentlemen, there is a commitment by the Kenya Kwanza administration to accelerate implementation of strategic interventions to address access and affordability barriers to healthcare across county governments. Our first point of call is a paradigm shift by all of us from looking at healthcare as an expenditure to viewing it as a core development input. Investment in healthcare, therefore, is a constitutional responsibility as our citizens have a right to health. It is against this backdrop and the COVID-19 context that Global Fund, through AMREF, as a principal recipient, allocated additional funding to strengthen the medical oxygen ecosystem in Kenya. We thank the Global Fund and AMREF for these efforts. I would like to note that efficient and reliable supply chains are essential to a resilient health system and central to achieving universal health coverage. Reliable supply financing as well as evidence-informed supply forecasting and procurement processes are critical in ensuring sufficient and timely supplies. In Kenya, the procurement and financing of health commodities is shared between the Ministry of Health, county governments, and development partners. The Ministry of Health and Development Partners finance the procurement of commodities for vertical programs such as HIV, malaria, TB, family planning, while counties procure all other commodities. At this point, I would like to thank AMREF for building a robust supply chain system that has been used to deliver the oxygen ecosystem by the Global Fund. A robust oxygen ecosystem is paramount to not only improving healthcare in Kenya, but also cushioning the country against catastrophic incidences when public health threats strike. Your Excellencies, ladies and gentlemen, despite these notable milestones, there are issues that persistently stifle the progress counties are making in health service delivery. Amongst them are changing disease patterns, health worker strikes, inadequate staff, especially in specialty and critical care areas, inadequate funding, delayed disbursement of equitable share and conditional grants by National Treasury, and now the raging of pandemics. The oxygen ecosystem grants supported by Global Fund address various health system gaps, which is a step in the right direction. We therefore have drawn lessons from the implementation of this grant, which include the need to improve coordination in the planning, design and implementation of the project. There is also urgent need for formulation of norms and standards for infrastructure and equipment, as well as strengthening procurement and project implementation processes for effectiveness, efficiency, and overall value for money. By addressing these areas, far much more reaching success will be celebrated. Ladies and gentlemen, we know that Kenya is currently in the process of developing the next phase of Global Fund grant. As county governments, we would like to once again propose that the grant have a mechanism where National Treasury sub-grants implementation funding to county governments. This is a request we have put on the table before the Global Fund, the Ministry of Health, and the Treasury to consider, but has not yet been honored in previous grants. Direct grant funding to county governments will go a long way in enhancing service delivery and building sustainability, especially at this point in time when donor funding is reducing. Finally, ladies and gentlemen, Your Excellency, allow me to confirm that county governments are ready to receive these oxygen cylinders and remain fully committed to providing the highest quality of health services. I thank you all. Thank you.